The next section is on characteristics. And there's two tables there. One is about content and the other is about these more considerations. The content lists the content that is available in the product. In this product, there are 6 different content areas, and the leftmost column designates how many cases there are. And one thing you'll notice about why is pediatrics highlighted, this is a feature of the software. Because we came from the pediatrics index, that term is highlighted. So if you arrived at this page, you would see that highlighted and your eye would be directed there quickly. So you'd say, that's where they talk about the pediatrics. And in this case, there is for Kathy's situation, there is one case for a 10-year-old who's post-op. The considerations are high-level things that you want to know early on, such as, is this content updated? Does it link to the EHR? Does it include psychosocial components, etc.? One of the things to note in this table and the rest of them is the far left column, which you'll notice is color-coded. The X with the red background means it does not exist. The green with the check mark means it does. And then there's a yellow with a dash, which signifies not applicable or does not apply.